In this lesson, we'll begin our discussion of the anatomy of the upper extremity by taking a look at the shoulder girdle and the humerus. So the shoulder girdle, which you could also call the pectoral girdle, consists of two bones. The first bone would be our collarbone or the clavicle, and the second bone would be the scapula, right? Or the shoulder blades is what commonly is called, but we're going to call it the scapula. Now, the function of a girdle, right, this shoulder girdle or the pectoral girdle, is to attach the limb, here's the arm bone, to the torso, right? Without this clavicle and scapula, we wouldn't have a way of attaching the humerus to the torso, right? And in a subsequent lesson, we'll take a look at the pelvic girdle, and the function of that girdle will be to attach the lower extremity to the trunk. So let's take a look at the clavicle. All right, so here's a view. We're looking down at the clavicle. From this view, you can see the clavicle is basically smooth. One side is going to be more rounded. Right, this is the side that's going to articulate with the manubrium of the sternum. This would be then called the sternal end. If you were to follow the clavicle now out to the high point of your shoulder, you'll notice that it becomes flat. This flat part is the acromial end. All right, so the acromial end is flat, the sternal end is going to be more round, right, when you actually feel the bone. On the underside, we have a bump. It's a little bit hard to see here. If you would kind of look at the clavicle from the side, it would kind of look like a teardrop or a water drop to me. This is the conoid tubercle, different ligaments attached to that. And then over here is something called the costal tuberosity. I didn't label it on this picture. Different ligaments would attach to that. Okay, so that's our clavicle. The scapula, which is commonly called the shoulder blade, is going to be a triangular bone. When you look at it from the back, this happens to be the right scapula, so it would be this scapula here on the skeleton. You could see a posterior view, and then that same scapula, this would be an anterior view. So on this slide, I'd like to go over the borders of the scapula. There are three borders. The border that would be like right here, if you follow my cursor on the skeleton, that faces the vertebral column, this would be known as, this would be known as the medial border or the vertebral border. Right? When you palpate the scapula, it's going to be thin. It's going to be kind of like a thin edge, and it runs all the way down. This is the longest border in the scapula. This other border right over here on the skeleton is going to head over towards the armpit. When you feel this one, it's going to be a thicker ridge, and it runs obliquely. This is going to be known as the lateral border, or you can call it the axillary border, right? Your choice. And then on top, we can see pretty flat. This is going to be the superior. Okay, so medial or vertebral border, lateral or axillary border, superior border. Right? And here's the same things on the front. So this would be the medial border or the vertebral border. Here's your axillary border. You can see it's much thicker, right? Thicker ridge when you pick up the scapula. And then here's a good view of the whole superior border. Now, these borders are going to form a couple different angles. I'm going to have you know two of the angles, right? There's actually more, but we're going to learn two. So where this medial border here meets the superior border right there, we're going to get this angle right here. This is the superior angle. Where the medial border meets the vertebral border here, we're going to get another angle right there. That's the inferior angle. All right, so this is a posterior view, and then again you can see on an anterior view the superior angle and the inferior angle. Now, when you look at the scapula posteriorly, the thing that kind of sticks out at you to let you know that you are looking at a posterior view is this big, thick ridge of bone. This is known as the spine of the scapula, or the way I put it here, the scapular spine. Where the scapular spine begins is known as the root of the scapular spine. We'll see like muscles like the trapezius is going to start right over here, or is going to attach over here, I should say. Right, so this is the root. This is the spine of the scapula. Now, if you follow the spine of the scapula up here on the skeleton to the top of the shoulder right there, that's going to be this. It's going to flatten out, and this is known as the acromion process, or you can just be lazy, you could say the acromion. All right, so this again, when you see this big ridge of bone, you know you're looking at a posterior view. Now, the socket that the arm bone or the humerus is going to join into or going to articulate with is known as the glenoid cavity or the glenoid fossa, right? You may remember a fossa is a shallow depression. So this whole round area here, all of this in here, is a subtle depression known as the glenoid cavity, right? So we're looking right into it here, and this is kind of like a side view of where it is. Now, one structure that's an anterior structure, again, this is an anterior view over here because you don't see the spine of the scapula. It looks kind of like a bent finger to me. Whenever I look at this, I kind of see a bent finger. This is going to face forward, like right there towards the front of the chest. This is known as the coracoid process. We'll see three muscles attached to this. One muscle that you do know is the biceps, right? The biceps in your arm. One of its tendons actually attaches to this hook right here. So this is an anterior structure. This is the coracoid process. Okay. So glenoid cavity or glenoid fossa, coracoid. Coracoid right here, sorry. And we see it over here too. Now, the last couple of things I'd like you to know about the scapula, there are three kind of subtle depressions that muscles are going to sit in. These muscles are actually the rotator cuff muscles. We have 4 rotator cuff muscles we'll do in subsequent lessons. These 4 muscles actually sit in these fossas, and if you get to know the name of the fossa, you'll see the name of the muscle is very similar. So here's what you need to do. Go to your spine of the scapula right here, and right above it there's a shallow depression, right? If you were able to hold the scapula, you'd be able to put your finger inside this fossa right here. This is known as the supra spinous fossa. Supra means above, and then spinous would be the spine of the scapula. Right? Supra spinous fossa. And you don't have to know this now, but the supraspinatus muscle sits in there. Go back to your spine of the scapula, and then below it is the infraspinous fossa. So all of this shallow depression, all of this here is going to be the infraspinous fossa. Infra means below, so that's going to be below the spine of the scapula. And we're going to see that a muscle called the infraspinatus sits in there, and then another one called teres minor. Again, you don't need to know that now. Okay, so go to your spine of the scapula. Supra means above, so above the spine of the scapula is the supraspinous fossa, and then infra means below. Below the spine of the scapula is the infraspinous fossa. Now, if you take your scapula and you turn it around, this fossa here would be sitting on the chest wall, and this is on the underside of the scapula. So sub means below, right? Like a submarine. So it means below. So this is on the underside of the scapula, and this is called the subscapular fossa. So all of this. And again, you don't have to know this now, but the muscle that would sit in there is the subscapularis. Okay, the last bone that I'd like to look at with you on this lesson is the arm bone. The arm bone is commonly known as, or anatomy I should say, is known as the humerus. Right? Commonly it's known as the arm bone, but this is going to be the humerus. It extends from the shoulder to the elbow. Right? So you can see here's the shoulder joint. Right, all the way down to the elbow joint, right? So this is known as the humerus. So let's do this. Let's divide the humerus in half at about this point here on the skeleton, and then we'll take a look at the top part, or the proximal part, and then we'll look at the distal part in a second. So the first landmark I'd like you to know is this rounded portion up over here. This is always going to face medially. If you notice, guys, on this picture here, that this round part and this round part are facing towards the midline. Right, that's important to help you, determine the different features of the humerus. You kind of want to know medial from lateral. So this is known as the head of the humerus. Just like us, under our head is a neck. So this constricted portion right here is the neck, and this would go all the way around the head. This is called, though, the anatomical neck. The reason we have to say anatomical is that our humerus is a special bone. It has two necks. There's another neck right about here where the shaft of the humerus is, the top of the shaft of the humerus. This is called the surgical neck. This is because when somebody breaks their arm, this is the most common place that it's going to happen. So they call it the surgical neck. Right? So you need to be careful on a practical. You just wouldn't want to say neck or neck. Right? We need to distinguish. There's two different necks. Anatomical neck is underneath the head. Surgical neck is in the upper part of the shaft of the humerus. So once you find the head, now jump to the outside, the lateral part. All of this big chunk of bone here, this is on the outside. So on this guy here, it would be like right over here. This is called the greater tubercle. We're going to see 3 out of the 4 rotator cuff muscles are going to attach there. Then if you go to the front of the humerus, right here, it's not quite as big. This is known as the lesser tubercle, right? So the greater tubercle faces lateral. The lesser tubercle faces anterior. On this guy here, it would be like in the front, right about there. So greater tubercle, lesser tubercle. Then right in between the greater tubercle and the lesser tubercle, there is a groove. I put a black line right there. The groove would run right in here. We call this groove the intertubercular groove. Right? Inter means between. Tubercular means the tubercles. I put on your checklist that you could also call it the bicipital groove. That's because the long head of the biceps muscle actually runs through there. So your choice, they're both correct, intertubercular groove or the bicipital groove. Okay, head, anatomical neck, surgical neck. Go to the other side of the head out here laterally, greater tubercle. Then you're going to go to the front of the humerus, lesser tubercle. And then right in between the two tubercles, 1, 2, you're going to see a groove, or you may have to feel it, right? You can actually feel it if you're holding the bone. That would be the intertubercular groove or the bicipital groove. Again, your choice. Now, the long part of the humerus here, like on this guy here, all of this is known as the shaft. About halfway down on the lateral side, you're going to see a bump. It's a little bit hard to see here. This is going to be called the deltoid tuberosity. It would kind of like extend in this general area here. It's not really shown that well on these photographs. That's the deltoid tuberosity. This is going to be the attachment point of the deltoid muscle, right, which is a muscle we'll study in the muscle section. Now, let's jump down to the lower part of the humerus, or the distal part of the humerus. What we're going to see here, guys, is that the distal part of the humerus is going to form part of our elbow joint. We're going to see that there's 2 forearm bones that attach to the humerus. The forearm bone that's on the thumb side, if you were to take a look at your forearm, the forearm bone that's on the thumb side is known as the radius. And then the forearm bone that's on the pinky side is known as the ulna, right? Radius and ulna. Those 2 bones are going to attach in this area right over here. Okay, so let's start with the landmarks. If you follow me here, if you follow my cursor, I'm going to go all the way around here. I'm going to go down and then across, and I'm going to go up. All of this This is known as the condyle, right? This is going to be the articulating point for the humerus here to join with the radius and the ulna. We're going to divide the condyle into two parts. The more lateral part, you can see here, forms like a rounded knob. This is known as the capitulum. The capitulum is going to articulate with the radius. Watch this. So here we have the capitulum, that would be this rounded part here, and now this is the forearm bone on the thumb side, right? If you were in the anatomical position, it would be on the lateral side, and you can see this here is the head of the radius, actually is going to go on the capitulum. Then as you bend your elbow, this radius will kind of glide along this capitulum. Right, so this rounded knob right here, capitulum. Then going from the capitulum over, all of this is known as the trochlea. The trochlea in Latin is a pulley, and we're going to see that the ulna bone is actually going to pivot around this pulley. To me, it kind of looks like a spool, like if you were going to take thread and kind of wrap it on a spool. That's what this looks like to me. Okay, so it's this whole area here. If I kind of drew an imaginary line right there from this over to the right. So this trochlea is going to articulate with the bone on the pinky side of our forearm. That is this one here. This is going to be called the ulna. So this bone right here is the ulna, and it's wrapping around the trochlea over here. So again, as you bend your elbow like you do a curl, this ulna here is going to pivot around the trochlea. Okay, so capitulum, trochlea. I'm going to stay on this slide for a moment. The next landmark we have above your trochlea, there's a pretty deep depression, right? You can't miss it. It's pretty easy to see. So this is called the coronoid fossa. Here's the deal. This pointy thing right here, we're going to learn in the next lesson, is known as the coronoid process. It's part of the ulna. When you bend your elbow, this pointy coronoid process would strike your humerus, and you would be limited in how far you could bend your elbow. So what's developed here is a depression that this coronoid process, this pointy part, can go into, so we can get complete bending of the elbow, like a complete curl. Okay, so we call this depression the coronoid fossa. It receives this pointy part here, the coronoid process. Above the capitulum, same thing. You can see this depression here. It's not as deep as the coronoid fossa. This here is known as the radial fossa, right there. That's known as the radial fossa. Same thing, guys. When you bend your elbow, this right here, the head of the radius, will go into this depression so that we can get a complete curl, right? Can bend our elbow completely. If these two things weren't here, if this fossa wasn't here and this fossa wasn't here, right, we would not be able to bend our elbow completely. So we call this the coronoid fossa. And again, you don't see it quite as well here, the radial fossa. Okay, so what are the four things we just did? Capitulum, trochlea. Above the trochlea is the coronoid fossa. And then above the capitulum is the radial fossa. Now, the next two structures are what we call epicondyles. Epi means above. Condyle is the condyle here, right? So it's like a chunk of bone right here, all of this. And then on the other side, not quite as prominent, right there, that bump. These are the medial and lateral epicondyle. If you were to feel on the inside of your elbow, there's a big piece of bone sticking out. What you're feeling is this right here. Now, epicondyles are for muscle attachment. Okay, so we're going to see that muscles of the forearm attached to the medial epicondyle, and then other muscles from the forearm attached to the lateral epicondyle. The last two things on this picture, there's two sharp edges going up right here. This is what we call the supracondylar ridges. One is on the outside, lateral supracondylar ridge, and then one is on the inside. This is going to be the medial supracondylar ridges, right? Different muscles attached to that. Okay, so on this photograph or this picture, capitulum, trochlea. Above the trochlea, coronoid fossa. Above the capitulum, radial fossa. The two epicondyles, you can't miss it. The big one here is on the medial side. Again, I always look for this to let me know that I'm looking at the medial side because it's so prominent. And then over here is the lateral one, not nearly as big. And then the two supracondylar ridges. Again, nice view of the elbow joint right here. And we'll study these radius and ulna on a separate lesson. Okay, so the last structure that I want to show you on the humerus, on the distal part, on the back side, right on the posterior surface, there's a really big depression here. Right, so there's one depression in the back where there's two depressions in the front. This is going to receive the prominence of our elbow. It's part of the ulna bone known as the olecranon process. So we call this big depression here the olecranon fossa. Let me show you what I mean. Here's a back view of the elbow. Look at this big chunk of bone right here. This is the olecranon or olecranon process of the ulna bone. So if you were to bend your elbow and feel that big pointy thing sticking out on the back part of your elbow, that's the olecranon process. That's this. As you go to straighten out your elbow, however, this olecranon process at some point would hit the shaft of the humerus and you wouldn't be able to straighten your elbow all the way. So by having this big depression, and just look how deep it is, this is going to allow complete extension of the humerus. Okay, so olecranon fossa. Okay, so that concludes this lesson on the upper limb as far as the shoulder girdle, which includes the scapula and the clavicle, and then the humerus. We looked at both the proximal and the distal humerus.